Infant and early years mental health is an area of research, programs, policy that involves investing in preventing and understanding mental health issues as early as possible in life, really in the 0 to 5-year-old period.
We sometimes don't consider that very young infants and children have mental health needs.
If you were to ask me today, if I could tell you how young children in Canada are doing, I can't answer that question because we don't ask that question in Canada and we don't actually collect the data.
Mental health, they often say, is the orphan of the healthcare system. Infant mental health is the orphan of the mental health care system.
Decades of brain science has made it abundantly clear that the early environment of a child is a major determinant of brain development and therefore the long-term mental health of children.
This is a time when children's brains are rapidly developing and the architecture is really being set for lifelong mental health and wellness.
Of individuals with mental health issues, we know that roughly 70% have their origins in early childhood. We also know that many children, fewer than 20% ever are able to access the mental health services they need.
When we think about the pace of children's brain development, how much they're changing week to week, we really don't have time to wait.
Many children in Canada are exposed to adverse childhood experiences, or what we call ACEs. And when these happen in early childhood and in infancy, we know that they're associated with long-term health and mental health difficulties.
Due to colonialism, Indigenous children and families experience a disproportionate burden of poor health outcomes as compared to non-Indigenous Canadians. The need to develop tools to monitor and understand early childhood mental health, that need comes from these communities themselves.
Infant mental health is not just in health, it's in the social sciences, it's because it's about relationships.
You can't just look at an individual child. You have to look at their context, and importantly, you have to look at the caregiver and the well-being of the caregiver and how they're doing and the relationship between the infant and the caregiver.
Warm, responsive caregiving and love can literally change the architecture of children's brains.
The MIGHTY Initiative, or the Mental Health in the Early Years Initiative, is a funding opportunity that was designed to improve systemic and equitable access to mental health early interventions in the early years. We're really proud through MIGHTY to be funding 5 really fantastic teams who are leading cutting-edge, innovative work, as well as a knowledge mobilization hub that is supporting the dissemination and the implementation of that research into practice and policy.
The primary goal of this project is to address a gap in services that exists for young children. The services, the supports, those systems often already exist in communities, but they're neither integrated nor is it obvious to families how to access them. So the purpose of Care Pathways is to create that portal, that entryway.
We have tailored our in-person program called Attach Parenting Program to an online format. The focus of our program is on promoting parents' reflective function. So their ability to have insight into their children's thoughts and feelings. Because we don't teach behaviors, we work with the parents to practice the skill that everyone has. Everyone possesses the ability to be reflective. But when you're in a stressful situation, those sort of capacities, they don't become the first response. It's intended to support families where there's a lot of psychosocial stress, parental depression or mental health issues, addictions, and family violence.
The Early Relationship Study is a study that's really focused on understanding how early relationships and the parent-child relationship can act as a buffer or can really enhance outcomes for children who have experienced adversity. Our research team is really interested in understanding how do we break these cycles of adversity, how do we best support mothers specifically and their young children, especially when mothers themselves have had long histories of trauma and are substance involved.
Our project is the BEAM program, which is an app-based program that we're implementing across the province of Manitoba to 400 families. And our goal is to address family mental health needs and prevent mental health and developmental challenges in young children. Waitlists can range from 1 to 2 years right now to receiving family mental health services. And so we're really hoping that BEAM will be available as a first-line program that can provide mental health support pretty immediately to families when they need it.
Our project is taking place with community partners in Maskwacis, Alberta, the Yukon, and Nunavut, and we have two main aims for our project. One is to examine the factors that are associated with successful implementation of the early years program, and our second aim is to co-create tools to evaluate early childhood program implementation in ways that really centralize Indigenous community priorities.
As a scientist and also as a mom of four, this investment I think is really going to move the needle in terms of our knowledge and our ability to really think differently about mental health in the early years. These teams are at the cutting edge of innovation and implementation science, and their hard work is going to benefit generations to come.
Mighty is an amazing program that actually has finally recognize the value of infant mental health to later development.
The opportunity to take some of our lessons from the pandemic, like the accessibility of programs through digital mental health, to provide more timely services to families.
And I think that if we can integrate across sectors services that are delivered to infants and young children, but also those that are delivered to parents and caregivers, we will be much better off.
Infant mental health, if you can promote it and work with families to promote the best outcomes in kids, you're going to have a healthier society overall.
Children actually being supported earlier than systems currently allow will literally change a child's life. And when you change a child's life, you change a family's life. When you change a family's life, you change a community.
What I would like to see change long term, no child is left behind or is overlooked when it comes to improving long-term mental health.